Our panel will return momentarily. Many Americans have been shocked, dismayed during the past week by the sight of thousands of their fellow citizens waiting for hours, even overnight, for medical services from a free clinic set up at the Los Angeles Forum. The event is the work of Remote Area Medical, a nonprofit foundation that's generally focused on bringing health care to rural America. Joining us from the site is Stan Brock, the founder of Remote Area Medical. It's a nonprofit volunteer airborne relief corps. Known to millions, he is as the co-host and associate producer of Wild Kingdom. Stan, how did this come about? What do you do?
Well, the whole idea was born when I lived down in the Amazon, Larry, and had a very bad accident with a wild horse. And when they were pulling me out from underneath the horse, they said, the nearest doctor from here is 26 days on foot. It was about that time that I got the inspiration for trying to bring those doctors just a little bit closer.
And that led to this. So how does this work? What's behind you?
Well, you know, I formed this organization to provide care in the other situations around the world. But shortly after we started it, I started getting requests to bring care to some of the areas in rural America. And that was many years ago, and it's just sort of grown from there. And now 64% of all the work we do is here in the United States. And so we're sort of backing off from some of the places where we really need to be, like in Haiti and Zimbabwe, because of the pressure here from all of the millions of patients that need the care we give free of charge.
And what can Congress learn from this?
Well, I think one of the things they need to learn from it is that the greatest impediment to what we do, Larry, is that for some extraordinary reason that I've never been able to understand, a fully qualified and licensed doctor, dentist, nurse, veterinarian in one state is not allowed to cross state lines to provide free care in another state, except in the state of Tennessee, where the law was changed in 1995 to allow it. So in Tennessee, we get doctors coming from all over the country to help out. Then we came to California, one of the other 49 states that does not allow it. And although we've seen many thousands of patients here, we could have seen twice the number had we brought in forces from outside the state to help.
Stan, we salute you. It's not our Hero of the Week time, but you are our Hero of the Week. Thanks for joining us. What do you make of this idea, Dr. Song?
Well, I think it's a sad statement on our society that we need to set up these free clinics in major cities like Los Angeles and have lines out the door and people waiting for many, many hours. If you talk about a waiting line, there's a prime example of that. But I do think that there needs to be a partnership within the private sector and public volunteers to offer this. I don't think it can just be shared just by one aspect of our society.
What do you think, Dr. Paul, Congressman Paul?
Well, I disagree. I think this shows the greatness of America. If we had a free society and a prosperous society, no inflation, no wasteful wars that we spend trillions of dollars on, there'd be so much wealth in this country. There'd be thousands of clinics like this. And like I said before, there'd be church hospitals. There would be more Shriner hospitals. They wouldn't be closing down because of all this government interference and inflation. Yes, we do have inflation. Just because the CPI isn't going up, the money, because of government policies, channels the money into medical care. That pushes prices up. That doesn't give you more quality care.
Dr. Gupta, what do you think it is?
You know, I've been to several of these places around the world, including Haiti, where RAM, Remote Area Medical, works, and it is amazing to see some of those same practices now here in the United States. You know, I'm not sure I completely agree with Congressman Paul on one point, though, and that is that, you know, if you leave it to sort of the goodness of man to try and take care of these problems, I don't know that it has been taken care of. I mean, you know, our private health insurance industry has created a situation where you have things like this sort of needed, necessary. So I don't know. You know, it's somewhat hard to imagine that the same things I saw happening in Haiti are happening right there.
I said it earlier. I'm going to bring you all back because we've just touched the surface. Thank you so much. Ron Paul, Paul Song, and Sanjay Gupta, doctors all. Michael Jackson's doctor, another doctor, speaks for the first time since his death. You'll see it next.